All right, Sabrina, so I set you up, and is it okay if I go over your treatment plan?
Yes.
Okay, great. So based on what we found today, you know the pocket numbers for your gums that I called out, that 1 through 3 is healthy, and 4 means that there's inflammation and there's bacteria that's starting to get underneath the gum line. And 5s and greater means that there's an infection going on, a full infection. And we had a couple of 5s, mostly 4s, but we did have a couple of 5s and the 1-6 on the bottom left. So I'd like to talk with you if you're okay with what I'm going to recommend and get approval from doctor. Is that okay?
Yes.
Okay. So you have a plaque-coated tongue, which means that I'm going to recommend bacteria all over our mouth. And when I see a patient who has a lot of like white on their tongue, I recommend that they use a tongue scraper.
Okay.
And what that does is it helps reduce the bacteria in your mouth. I'm also going to recommend, because of the periodontitis, which I'm going to go over really quickly what that is. I've got this visual aid.
Okay.
So what that means is that when we don't, when we need to get a better home care regimen, like morning and night for brushing, and we don't do that, the bacteria builds up, kind of like a turtleneck. So if we wear a turtleneck and we never wash underneath it or clean it out, it kind of starts to, you know, not smell very good, and kind of infection goes on. So that's kind of the same thing with our gums around our tooth. So we need to go in because the bacteria has built up enough where it has actually caused inflammation underneath the gums. And this is from Colgate, and I have printed it out so that you can take this home with you because it shows the early stages of gum disease and how it progresses. So like you've got some swelling, you've got some bleeding when you floss. And then what happens is with that infection is we want to go ahead and clean it out because we don't have the ability to do that with floss. Floss actually just goes for 3 millimeters deep. So when we floss our teeth, 3 millimeters, so the 4s, 5s, and 1-6 that you got, it's not going to get down there. So we have to go in and we have to clean out that bacteria, clean out the tartar, which is really called calculus. And once we do that, that tissue, our gum tissue, has a chance to become healthy again. So what we'll do is, that's what I'm going to recommend. I'm going to have doctor take a look, see what's going on with it, and if she agrees, we'll move forward. We'll bring you back.
Okay.
Okay, so from there, you're going to come back for a couple of visits because in our clinic, we divide the mouth in half. So we'll do a local anesthetic just so to make you comfortable. And then what we'll do is we'll bring you back in 4 to 6 weeks to reevaluate the tissue, make sure it's healing really well. And then I do want to place you on a 3-month visit with us. And the reason being is because that bacteria has a chance to build up quicker than most people. And if you're doing really good home care and we see improvement within probably about a year, we can reevaluate and see if you can graduate to a 4-month appointment. So is it okay if I share a couple of things with you about what I'm recommending for your toothbrush and your flossing?
Sure.
Okay. So I am recommending a electric toothbrush. Is that something that you use? Okay, awesome. So twice a day, I'm going to still recommend you use it. And then do you use traditional floss or do you use a water pick?
Traditional.
Okay, great. So if that works for you, I'd be happy with once a day. If you can do that once a day, the best time is at night.
Okay.
Okay? And then I am going to recommend a non-alcohol based mouth rinse to reduce the bacterial count in your mouth. So I'll give you some samples of some Crest Pro Health. And that's not going to irritate your tissue in your mouth. And like I said, I wanted to give you a tongue scraper because your tongue is a little plaque coated. And then I'm also going to be recommending a special, I saw in your paperwork you like to chew gum, so there's a special gum that has xylitol in it. It's a special sugar that it's a sugar alcohol, and our bacteria in our mouth can't digest it. So it actually helps fight against cavities.
Ooh,
and
good.
it comes in gum or mint. But I saw you chew gum, so that's why I'm recommending that. And then your PCR, which is your plaque count, when we painted your teeth pink and we saw kind of how your brushing was doing, it was probably around 30%. So that's actually really good. We want to get it a little bit lower. So I always like to ask my patients at the end of their time with us, what would you like your percentage to be? Lower is better, higher is not. So you're at 30% now. Where would you like to be at the end with doing home care, everything we've talked about?
Lower, you better, than you said.
Yeah, so do you want to shoot for like maybe 20%, reduce it 10%?
Yeah, sure.
Okay. Do you have any questions or concerns about any of the information we went over today?
No?
No?
Pretty,
Okay.
pretty clear.
Okay. All right. So I'm going to give you this to go home with. If you have any